Welcome to discussion group for the Challenging Behaviour National Strategy Group. We have a range of experts with us today with a focus on advocacy, self-advocacy and co-production when it comes to accessing health and social care services. So my name is Michael Fullerton from Achieve Together, and to my left we have...
I'm Scott Watkin, I'm from Seeability.
My name is Michael Staller and I work for Campaign for Change.
My name is Jane Bell, I work for Campaign for Change.
My name is Elmi, I work for Achieve Together.
I'm Coral from the Challenging Behaviour Foundation.
I'm Jackie from the Challenging Behaviour Foundation.
I'm Crystal from Campaign for Change.
I'm Stephen Adamson, part of Campaign for Change.
Thank you very much. And so a brilliant range of experts today. We're focused on some specific questions around support and services. And so we'll start off with the first question.
I have been going to the doctor now for about 3 months because I have a severe back problem. But the doctor has now refused to see me until I get physio on my back because they think the x-rays are satisfactory. And sometimes it feels like actually they think they know best. We know when we're in pain or there's something wrong.
I've always been involved when making decisions about mainly my care, but obviously not everyone is involved with making decisions, but I'm involved with doing my support plan with team members, budget plans, menu plans, activity plans, just anything that I need to do with my support and health, I'm involved in.
Lots of people think that we don't have capacity, and actually we should never assume somebody lacks capacity until proven otherwise. There's something around how teams support people to communicate in the way that the person's needs need to be communicated. So not forgetting those people who may not be able to speak and who may not be able to have the opportunity to say how they're feeling. I think we have a long way to go with health inequalities, and actually one of the things that we need to get better at is making sure that we bolster our learning disability nurses, but also we need to make sure clinicians and doctors and nurses really understand how to work with people with learning disabilities.
So it's important for people with learning disabilities to be involved in decisions about their care and support because they know what support they need and what care they need.
But I think it's important people have a say in their life and have a say and control of their own life and what they want, and not just being people be judged to see, oh, he has to be controlled, but I can communicate myself and let you know what I want in life, and how my care package and my care plan and how I run and how I key working sessions. CONTROL, being in control of my life.
People who cannot talk. Just because people can't talk doesn't mean that they can't be involved in decisions with their care and support because there's different ways of communicating.
Even if the person lacks capacity and is not able to make that decision, they still need to have their views heard. They still should be in the best interest meeting, and they still should be at the heart of their care.
It's about your health and well-being. It's for your health and well-being.
It is important because you have to be in control. You can't let no one push you, like, you have to stand up. So I'm in control. I let no one push me or bully me and tell me this. I stand up for myself. I'm in control. You can't just do that. It's my decision. I make my own decision. I don't let no one make decisions for me. Before, I wasn't in control. It was tough. And being in the hospital is like, it's not easy because you have people you can't do what you want to do.
Control's like taking away.
Control to take away, and they're in the hospital like a zombie, like the medication they put me on. It's like I'm walking like a zombie, and it wasn't nice. Since I'm out of the places, I'm a better person. I do my own thing. And I've done well as well.
Wouldn't want to go into hospital for what me or Julie had to go through. So I'm a better now person now. I've come far. I've got to college, done everything.
And comparing that now, do you feel that health, social care staff really listen to you now?
They listen to me. Come along with the medications and properties I'm on it was still there, but they've really done the dosage. Now I'm going to college. I've been to work. I'm in a lovely relationship, I'm engaged, I've been on a holiday, got my best pal, I live with Julian. Couldn't be better.
It's just a shame your team haven't won the league for a while, have they?
Thank you for that.
Stop! It's not about football.
Sorry, Sunderland.
When they don't let me listen to me, I feel disempowered, and I hear similar stories that people feel disempowered. It makes you not want to access those services to get your health needs met.
What's the point of me telling you then if you're not going to listen? I feel a bit frustrated. More than that, actually, frustrated and depressed and annoyed.
Yeah.
They said, you guys, you've got these things on the side of your head, haven't you, fellas? You're doctors and you're not using them. Well, what they could have called in is you listen to me, yeah?
Well said.
It's like a couple of years ago when I went to the doctor with my key worker. He was speaking to the staff, and then the staff stopped looking at him, so he had to speak to me.
Good on them.
So we've been forced to speak to you, directly to you.
Yeah.
How did that feel then?
I was getting a bit annoyed.
When people don't listen, it can result in not very good outcomes, like you become ill or your life is shortened because you weren't listened to. Like Oliver, he passed away because the nurses, and it wasn't just him. They weren't not just listening to him, they were not listening to his family, and it resulted in his life being shortened. The message for doctors would be communicate in a way that is suitable for that individual. Give me some information, like what the medication is, what it does, the side effects, that little bit more information that the doctor has explained in a easier, simple format
Because you're in control. You can't let no one rule over you with that. It's your time to speak. I'm speaking now. I'm not letting no one tell me you have to listen to what I gotta say. Listen.
Well, firstly, I'd start with the Equality Act. I'd ask everyone to read the Equality Act inside out because I don't think they understand it and I don't think they know it. And that will start to tell you how people should be treated. But why, I would ask them the question, why is it okay to treat people with learning disabilities with no equality and to treat us very differently? So I would start with that. Secondly, I'd ask health and social care to talk to each other. So the NHS and social care to start talking to each other because they can both work together and support not only people being left in hospital for a very, very long time, but equally social care will be able to help make sure that people get out of hospital quicker with the right support. But it also has to be with the right placement for the person, and the person should have the choice of where they go instead of being told you're going here because this is the only bed available for you. We need to make sure that we have a robust, fit for purpose workforce in learning disability nursing because we know that half of the learning disability nurses will be retiring soon, and actually we need learning disability nurses to be advocates on our behalves and to being able to advocate for our care and support. We're still seeing people die 20 years earlier than a person without a learning disability, and people still think that that's acceptable. Well, in my eyes, that's wrong, and if we get it right, healthcare right for people with learning disabilities, we get it right for everybody.
More money for probably for carers, support workers. There's a lot of staff or agency staff before, and better might be the government to get more money for social care and help the main staff with better training, similar to what Scott said, and also to have good training, people that can't talk to themselves, advocates as well for people to talk that can't explain themselves or want to go through, or people that have patience and skills in listening to advocate for them and then just have rapport so they feel that they're understood and listened to. Good money, better money for reform of social services, and the both companies to work together in quality services as well.
Pay staff more money. Because to start work hard, so you need to be high paid. Start with hospitals as well. Just need people to come out of the hospitals. Because hospitals ain't great. Being there, it's not nice. So you need to come out of there.
So one thing I would change is for support workers, team members, doctors, nurses, anyone that is going to be working with people with disabilities, to have more training.
It's about the NHS need to be more efficient with their money, not to do so much waste. That's what
You think it's too much wastage?
Yeah. Put the money where it needs to be to help them efficiently and not waste money going on things that should be important, but things that are important like social care, like Stephen said, to go on things that are going to support the people, better payment for staff, better payment, better training, better structure, and not putting your money on things that don't really necessarily are important to us in the UK, you know?
Yeah.
Action, if you're acting on it, means you're listening. So when they listen to me, that's it, one word, A. CTION, action. If you're actioning and you're doing the action, you can just say you're listening. I don't want to hear that. I want to see the action in the future to show me that you're listening to what all of us are saying about the whole situation. Actions speak louder than words.
Action!